And when a man has received a diagnosis of cancer, he needs to be thinking about saving sperm for future fertility, particularly if he's undergoing chemotherapy or radiation that may damage the testicle. So the best thing to do is to call a fertility specialist. That's the best thing before he even starts his treatment, if he can. I think you'll find his oncologist very willing to be supportive of this, to bank sperm, so that's available later. Even if he never uses it, it's nice to have that in the bank. In most cases, we would ask the men to provide more than one sample. There's sort of a feeling that the more sperm you have, the better it is, particularly if this guy's cancer treatment is going to destroy testicular function. And so we would ask for several specimens, in fact, as much as he could give us prior to undergoing his treatment. When a man does collect several samples for use in the future, this sperm is then cryopreserved and is actually stored for a long period of time, according to how long he needs. It may be that he wants to use it in a year, or it may be 10 years. The good news is this will last almost indefinitely. So he has that option. So a lot of times the sperm is moved to long-term storage. And it costs a few $100s a year to save it, but it's really good insurance. Occasionally men don't have time to collect a specimen prior to their cancer chemotherapy or radiation, or it's also possible that they didn't know about it and they learned about it at a later date. In that situation, the first thing we do is ask him to provide a sample to see if sperm's still being produced. And it may be that he has plenty of sperm. But if he does not, if there's some sperm, then higher technology will help the couple achieve pregnancy. For instance, if the sperm count's normal, then intercourse may work. But if the sperm count's very, very low, they may need to undergo in vitro fertilization. As long as there's some sperm, there's hope.